How's it going, everybody? My name is David Schrock. I'm one of the family medicine physicians here at CHAS Center. I'm here to talk to you a little bit about preventative screening for men as part of the Wellness Wednesday live series here as part of this is Men's Health Month. So I wanted to give people a little bit of an understanding of what kind of screenings they might face coming into the doctor based on your age and kind of help you understand so it's not all a surprise when you come in and give you some tools to talk to your doctor about that. As we're waiting for people to join, I also just wanted to put a plug out there for anyone not aware that CHAS is currently offering the COVID vaccine. If you can give our office a call and we can set you up with a visit to get your vaccine series started. I'm vaccinated, our other providers are vaccinated, and we're all happy to answer any questions that you guys may have about the vaccine. Given the prevalence of misinformation out there. So please feel free to put any questions in the comment section as we go along. But if you are, as I said, if you are interested, we usually have a turnaround of usually within a day or two of getting people in and getting people scheduled to get that first vaccine. Like I said, I'm one of the family medicine physicians here. We have a variety of both physicians and nurse practitioners who provide preventative care here at CHAS. And like I said, I wanted to go through, I think that we face a lot of common questions as we see men for preventative visits. And so I wanted to walk you through a little bit about what to expect and why we might recommend the kind of screenings that we recommend for you. All right. So I wanted to divide this up for anyone out there watching so that they can anticipate kind of what type of screenings might be good for me to talk to my provider about based on how old I am. Certain things we only screen for at certain ages, and there's a reason behind that. And so we'll kind of talk a little bit about what types of things to expect and why we might recommend screening for those things. So if you're a man aged 18 to 39, there's not a lot of cancer screenings out there that are recommended. However, one thing that we always offer at our physicals, our yearly physicals, is screening for sexually transmitted infections. So why might we need to screen for those in somebody who isn't having any symptoms? Well, for men who have chlamydia, which is the most commonly transmitted sexually transmitted disease, 50% of men have no symptoms. With gonorrhea, it's a little bit lower at 15%, but still, that's a significant amount of men who may be carrying this infection and not be aware of it. And more importantly, both of these are easily treatable. We also offer blood tests for screening for HIV, syphilis, and hepatitis C, which are all also sexually transmitted infections. And it's actually recommended that everyone is screened for HIV and hepatitis C at least once in their lifetime, anyone over the age of 18. Once you turn 40, the same screening for men ages 18 to 39 applies, but there's a couple more things that we start screening for. People who may be at higher risk for diabetes, we recommend getting a blood test called an A1C. This checks what your average blood sugar is over the last 3 months. So not necessarily affected by what you've eaten the last day or the last couple of days. This is an average over 3 months. And this will tell us if you have if you're in a range where you're at risk of developing diabetes in the future, or if you've already developed diabetes. Sometimes we'll do this a little bit earlier in your life if you have a higher risk for it, but typically we'll start at age 40. We also will screen for high cholesterol. These are both tests that we can do in real time at CHAS right at the time of your physical. And so you'll have those results and be able to talk about them with your doctor at the time of your visit. A lot of things that we recommend that we can treat some of these things if they come back elevated don't necessarily even involve medication. We can talk through ways of improving your lifestyle, exercise, those types of things as well. The next age group that the screening changes is between ages 45 and to 54. So this was a new screening update that happened earlier this year, and it is now recommended that men who are over the age of 45, all of that previous screening still applies. However, it's now recommended to start at age 45 screening for colon cancer. There's a couple different ways that we can do that. The most common way that common thing that we use here at CHAS is called the FIT test. FIT test involves providing a sample of stool to our laboratory, which then will test it for signs of blood. Blood in the stool, even if you can't see it, is one of the most common early signs of colon cancer. And if that's positive, then we'll work to get you plugged in with a gastroenterologist or a GI doctor to have a more detailed screening test called a colonoscopy. We can also refer patients to have a colonoscopy for a regular screening test, even if you don't do a FIT test. And if that comes back negative, you only have to do that once every 10 years. Previously, this recommendation was for any men age 50 and over. It was recently changed down to the age of 45, just because we're starting to see more cases throughout the United States of colon cancer under the age of 50. So once you hit age 55, all of the prior screening applies. However, one of the most important things and one of the most common things that I'm asked about from men from this age group is, do I need to get my do I need to be screened for prostate cancer? And I wanted to talk a little bit and dig into this a little bit, because I think there are some misconceptions that stop patients from wanting to talk about this or even coming into the doctor because they're worried about what they might have to go through. So in the past, screening for prostate cancer was typically involved just a blood test or a blood test and what's called a digital rectal exam. It's important to note, digital rectal exams are no longer required or even recommended for screening. We screen for prostate cancer with a blood test, and that's it. So don't let a fear of an exam prevent you from coming in and seeing your doctor and asking about this. Who needs screening for prostate cancer is a little bit more, there are a few more factors that apply, because not everybody actually needs to be screened for it. So people who have risk factors, who have a higher risk of developing prostate cancer, include Black men, anybody who had a first degree relative, dad, brother, diagnosed with prostate cancer before the age of 65, folks who are cigarette smokers, and folks who are obese. However, if you don't have any risk factors, then it really depends. And this is where a conversation with your doctor about whether you need to be screened and what their recommendations are really comes into play. But I wanted to give you a little bit of an idea of how I have that conversation with my patients. If any of you are, in fact, my patients, one of my patients in this age group, you've probably seen this graphic before, because I use it a lot when I'm talking with my patients about screening for prostate cancer. If you were to screen 1,000 men of average risk for prostate cancer, about 240 of them would have a positive PSA result. PSA is that blood test that we use. So a positive PSA doesn't mean that you have prostate cancer. It just means that that's the best way that's the best method that we have to screen people for something that might be prostate cancer. However, there are other things beside prostate cancer that can lead to an elevated result. Things like a prostate infection, or simply just having a larger prostate that isn't caused by cancer. Those who get a positive PSA result have to get a prostate biopsy. And so a prostate biopsy involves a referral to a urologist, and a procedure that always involves risks of bleeding, pain, infection, those types of things. And of those, about 100 of those men do have a biopsy result that does show prostate cancer. However, what's really important to know is when this test was first developed, we started screening all men, starting at age 50, 55. And what we found was that we were finding a lot of prostate cancer. We were treating a lot of prostate cancer, but not all of those prostate cancer cases were would have gone on to be actually relevant to the patients. They would have to live to be 150 before it started causing any problems, because many of the prostate cancer cases that were being found and treated were growing so slowly that it really was unnecessary to treat. So, however, if you do get a positive prostate cancer biopsy, about 80% of those men end up going on to choose that they want to have surgery or radiation treatment, some form of treatment for that prostate cancer. Of those 80 who are treated, it's important to know that approximately 50 of them will have permanent erectile dysfunction, inability to achieve an erection, and 15 of them will have permanent urinary incontinence. Some of these things are temporary, some of them can be treated, but those are the average number of men who face those complications. And of all of those patients who are treated, only one of that original 100,000 avoids death from prostate cancer. Only 3 avoid that cancer from spreading to other organs. And even though we were able to diagnose prostate cancer, 5 of them still died from prostate cancer even after surgery or treatment. So what I wanted to highlight with this graphic is that it's actually much more likely if you were to get screened without any risk factors that you end up with a complication from treatment than you would be to actually die from prostate cancer. Now, I do also want to highlight that that doesn't mean that you shouldn't be screened. What that means is that you should have a conversation with your doctor about your risk factors and about what's most important to you, whether it's most important to detect that 1 out of 1,000 or most important to talk about the side effects. I can't give you a personalized recommendation here, but that's again a reason that I would recommend going and seeing your doctor. For men who are 75 and older, the only changes that are incorporated into the screening recommendations is that colon cancer screening is no longer mandatory. The reason behind this is because colon cancer is typically a fairly slow growing type of cancer. And because men's life expectancy is typically less than, is under 85 years, it's not necessarily mandatory that we continue screening. It's still optional, and that's again another conversation you can have with your doctor about whether you need to continue having it. But it is, and more importantly, prostate cancer screening is actually no longer recommended. So hopefully that was able to give you guys a quick overview of what to expect if you're coming into your doctor's office when we talk to you guys about preventative screenings. Feel free to leave any questions or anything like that in the comments section. Feel free to give us a call and set up an appointment for a physical for any of these screening exams. And as I said before in the beginning, if I wanted to end with a plug for our initiative to get as many people in Southwest Detroit vaccinated with the COVID vaccine as possible. So if you have any interest in scheduling an appointment for that, you can give our office a call. There's an option on the phone tree to choose that. And if you have any questions about the COVID vaccine or are hesitant about it at all, please feel free to schedule either a virtual appointment with us or to come in person and see us to talk to us about it, because we'd love to talk to you about it and dispel some of the myths around it. That's all that I've got for you. And yeah, hope you all have a good rest of your day.